On tonight's programme, under pressure, a Yorkshire GP surgery warns government cuts may force it to close. Good evening. A GP practice in West Yorkshire is warning that its services could be forced to close because of cuts to their funding. The Slaithwaite Health Centre serves nearly 5,000 people, but it fears that contract changes could damage patient care and drive it out of business.
But NHS England says the contract changes, which are happening nationally, are about making GP funding fairer. Our health correspondent Jamie Coulson has this.
Are you well?
Yeah, fine, thank you.
Good.
At the Slaithwaite Health Centre, doctors say they're increasingly concerned their services could become unsafe and the practice may have to close. A contract change means the practice is facing a loss of over 40% in its funding, something the GPs say will inevitably damage patient care.
I feel desperate about the future of this practice. With these cuts, this practice will close in its present form in 12 to 18 months, I believe. And I think that's a real loss for our local community. I'll sort that prescription out.
Last September, they saved my life. They sent me to hospital. I came in with chest pains and everything. They sent me to hospital, ECG, and basically saved my life. That's how important it is to me.
The practice income is falling because of a national review by NHS England to even out the funding differences that exist between different GP practices on different contracts to provide core services. NHS England says the review will create a fairer system, but for some practices this redistribution of money will mean a significant loss. The practice serves more than 4,500 patients through a locally agreed contract called a Personal Medical Services Contract. It has an income of £635,000, but over the next 3 years we'll see that drop by 43% to £358,000. 22 out of the 38 practices in Greater Huddersfield are on the same type of contract, and all bar one will see a drop in funding. The local NHS point out that Slaithwaite Health Centre has the highest funding per patient in the Greater Huddersfield area and that the redistribution of wealth will help other practices. They also say that services will continue to be provided at the health centre, even if not by this group of GPs.
Patient care will be funded at a lower level. That means long waits for patients trying to get appointments at whatever replaces us. It means the local community probably accessing the A&E department while it's still there.
A campaign run by the doctors and patients has now started to try and save the existing services and bring practices together from across the country facing similar funding cuts. NHS England say the practice hasn't suffered any financial loss so far and that all services will continue until discussions have concluded. They say they expect to meet with the practice in March to agree a way forward. Meanwhile, the doctors and patients say they'll fight to protect their services. Jamie Coulson, BBC Look North.
Well, let's talk more about this now with Dr James Kingsland. He's president of the National Association of Primary Care and joins us now from our studio in Liverpool. We've been hearing there, NHS England says this is about making the system fairer, about redistributing the wealth. What's your view?
Well, Nicola, good evening. It's a complex issue. And we do lack a corporate memory sometimes in the NHS. In '97 we created different contractual arrangements for general practice because it was recognisable that a one-size-fits-all, a national contract for a diverse need across England may not be appropriate. So we created this thing called Personal Medical Services, and this is the issue that is being challenged by the practices in Huddersfield. The difficulty is it was always meant to be a cost-neutral exercise, so PMS practices didn't enjoy any more income than they previously received unless they were going to do new service because of a particular local need, commissioned more locally rather than nationally. The question is now, with this review of personal medical services nationally, and over 40% of all GPs in England do work with a personal medical services contract, whether that redistribution or indeed the loss of income to lots of practices may destabilise their service.
40% do, but that means most GPs aren't on this kind of contract. So surely they would welcome the news that funding will now be more fairly distributed.
Well, I think we would all welcome a fair distribution, but no one would welcome an over 40% cut in any single practice. Have to remember that general practice in the main are run by independent contractors. It's a self-employed system, and I would suggest any service that was having a 40% cut would have great difficulty continuing to maintain the quality that they previously delivered.
We've seen there is a lot of anger locally. If these cuts do go ahead, what happens to patient care?
Well, there is the potential, and I think this practice has said it may be difficult to continue providing any service and is considering closing. Of course, those 5,000 residents would therefore need to find another practice, which puts pressure on the system elsewhere. And at a time when we're looking to try and ease pressure on the hospital sector, A&E services, outpatients, and move that into the community, it does fly in the face of a system that is already under strain and is being downsized.
Dr. James Kingsland, thank you very much for your time this evening.
Pleasure.